It is that time of year here in the DC area. As I record this, we are just transitioning into spring in the first week of April. The cherry blossoms are out. If you're downtown right now, there are people everywhere that are excited to enjoy the weather and see the beautiful trees that we have for just a few weeks right now. And if you're a runner, oftentimes this is when we really jump back into it if perhaps you took that volume down or maybe took the winter off altogether. It's a common story, right? In the winter, the weather was kind of crummy. It's harder to get outside here in a cold climate. You're not going to want to do that. And then now that the weather turns, you want to get back into it. And most of us are pretty smart about how we get back into running. We'll take it easy and slowly ramp up for maybe the first week or two. Then we start feeling good, feel like our lungs are back. And then we start ramping it up a little bit more. And then, boom, suddenly your knee starts getting a little bit cranky. And the reason for this is oftentimes our ability to catch up from a lung capacity or cardio capacity is greater than maybe our joints, tendons, ligaments, these soft tissues are able to keep up with. So essentially, we feel caught up from a cardio aspect, but your joints are saying, hey, I'm not quite ready. And this sudden increase in cumulative loading is just exceeding the capacity of what perhaps our knees in this case can handle. And we have to think, well, why our knees? Well, it can be a few different things. Your knees often end up being sort of the victim of other things, where instead of it being just a pure knee problem itself. Now, of course, it can be a knee problem. If perhaps we don't have the loading capacity at that joint specifically itself, there are things we can do to improve that. So one of them is simply improving things such as quad strength. So I know for me, I've struggled off and on at times with a little bit of a right knee issue. And one of the drills I do to just kind of maintain a little bit of that tendon loading capacity in my knee is just a single leg wall squat, where I just do a single leg wall squat on the wall. I just make sure I can hold for about 20, 30 seconds. And I do that randomly once or twice every single day, especially before I'm about to do a workout or a run where I know it's going to be a lot of loading on my knees. Another is perhaps we don't have great strength or control at the hips themselves, and the muscles in our hip, they attach onto our femur, the bone in our thigh, which actually goes down and makes up the top half of our knee. So having good control at our hip directly impacts what's happening at the knee itself. So one thing we can do is just incorporate a couple drills such as these that you can do maybe in your warm-ups for when you are going to do a cross-training workout or you're going to go out there on a run itself. And then finally, another area is our ankle mobility. If perhaps you have a little bit of an asymmetry in how much mobility you have in one ankle versus the other, that can alter maybe your loading patterns or create some differences from side to side that will accumulate over the thousands and thousands of strides that you have in a given run. So a quick little test you can do is pop into a half kneeling position with one knee on the ground. See how far your knee can advance over your toe on one side compared to the other while keeping that heel down. I usually aim to drive that knee right over the second toe and see, does one ankle feel a little bit tighter than the other? If that's the case, it may be worth working on some drills that help to balance that out. Here is one in particular that I've done before, and in here you're simply almost mimicking the test that you do, and you're just holding for a few seconds at the end of each rep, and sometimes I'll even have somebody press the front half of their foot into the ground to make the muscles behind the ankle have to work in this position, so then your body knows what to do when it actually gets into this position, and then our body will reward us by giving us this mobility because it says, hey, I can work and operate in this position. So if you're somebody who has just jumped into running or ramped up your running as the weather has gotten nicer, but your knee's gotten a little bit cranky, or another area for that fact, there are a lot of things such as these quick examples we showed today that you can do to address it. And perhaps we maybe need to think about how we can tweak our ramp up in terms of our mileage and those sorts of things to ensure that the joint loading capacity is progressing along with our ability to keep up from a cardiovascular and respiratory standpoint. So if you're somebody who's looking for a little help, a little guidance on any of these fronts, we see a tons of runners and we would love to be able to help you.